Hello, hello, hello. Good evening, students. Good evening. Can all of you hear me? Can all of you see me? Am I visible to all? Am I audible to all? Can I get a confirmation that from where we are streaming, there might be a lag of just around 30 seconds. So can I get a confirmation that all of you can hear me? All of you can see me? Hello, hello, hello. That all of you can hear me, all of you can see me. Hello, hello, hello. That all of you can hear me, all of you can see me. Yes, I think I am audible to all. I think the audio is also good enough. And yeah. So am I visible to all? Am I audible to all? And I think just a second. All of I just need to see the chat boxes. Yes. So yeah, okay. So all of you, welcome all of you to this session where we are going to discuss, I think the audio video is all good. Welcome all of you where we are going to discuss some of the frequently asked MCQ for this upcoming NEET PG examination, frequently asked questions for this NEET PG. But even if you are FMG student or a final year student, will definitely benefit you. And we are going to give you some at the end of this. So first 15-20 minutes we're going to discuss some MCQs in this topic in this class, but then I am going to give you very important, very important, the list of important topics which are likely based on which the questions would be coming in the NEET PG, and how what maximum, since now the exam is postponed, what we can do in this whatever time of February it is remaining, and then March and April, how we can finish off the revision rapidly, specifically from the OBGY point of view. Okay, so I hope all of you, and please participate so that you get any doubts you can ask me in the chat box. Okay, so but just a couple of things before we begin. So this is very important. I want all of you, this is the All India mock test, very important, 26th of February in the morning at 9 a.m. okay, mentor will be the code MENTOR to unlock your free plan on the Unacademy app and enroll for the exam. I repeat, it's 26th of February, 9 a.m. in the morning. We have got a All India mock test which is there for all of you. It's a completely free exam, okay, free for all exam is there. Okay, this is also very interesting. When you buy a 3-month subscription, entire 1-month plan is free, so that also all of you can take the maximum advantage of this and enroll as soon as possible. Rest all of you know the plus, but those who are new, plus subscription, what all do you get? Live classes, recorded classes, anytime, anywhere, best top educators, quizzes, MCQ, question bank, test series, and any device, laptop, mobile phone, computer device of your choice. Okay, iconic subscription also available. The code remains the same, MENTOR, and unlock, and you can go for the paid subscription. Unacademy and both you can take for if your long time preparation is your goal, then you can take this iconic subscription also. And these are fabulous results in the FMG NEET PG examinations, and this is again very important. All the top educators, Educator curated. So 9th Feb there's a test, 11th Feb there's a test. Okay, so 9, 10, 11, almost all the days there are tests. The timings are there. So just you need to download the Unacademy app, and mentor code you can use to unlock the free content and participate in lots of free tests. Paid subscription also with the same code. So you get interactive classes, polls, raise the hand feature where the student can directly talk to us, and never miss a class, anytime, anywhere, study material downloadable, and of course doubt solving sessions are there. Okay, this is one more very important batch which is starting for the 3 months duration. Okay, all the 40 educators will be live. Okay, 90-day duration from 11th of February to 10th of May. Okay, grand test will also be there, and 140 hours of lectures will be there, and all 19 subjects will be covered. Okay, so it'll be revision classes, plus you get lots of study material and grand test and discussion. So this is very good preparation for all those, and of course mentor remains the course you can take, and with 3 months subscription, 1 month you're getting free. Various other batches also coming up. The focus FMG batch, the target next batch, the slow structured base will be a part of all the batches. Okay, so depending on your requirement, 3 months, 6 months, 9 months, or even 1 year subscription you can take with the code mentor. Okay, so with this we begin our this was for this thing, and we begin our the discussion. I want all of you to please participate and answer. Right, wrong does not matter. Okay, so yes, the same thing. Yes, now anybody, can you just tell me? Yes, the first question for the day, again a very frequently asked topic. So what I have chosen is the most important topics which are there. So this is a MCQ on ectopic pregnancy. Every year ectopic pregnancy MCQ comes for sure. So which of the following is an indication for doing a surgical management in a patient of ectopic pregnancy? Anybody in the chat box, can I get the answer please? Surgical management, when will I do? Surgical management, when will I do? Okay, Kevin R. Jain. Kevin, yes, Kevin, is the audio video all clear? Can all of you hear me and all of you can see me, right? Yes, audio video is all good. Okay, anybody else want to try before we proceed with the answer? Yes, so William Stephen is saying absence of character, option number C. Okay, yes, so all of you please pay attention that we are talking about the MCQ is basically medical management versus surgical management. Can anybody tell me what is the medical management of choice? Which is the medical management of choice, or what is the treatment of choice, medical or surgical? Yes, anybody? So all of you remember that medical management is the first preferred method or the treatment of choice wherever the conditions are satisfied, and when the medical management is not possible, then only we go for surgical management. Okay, so many years back directly surgery we used to do. Now always remember medical management is the first thing which we offer to the patient. Now which drug? Very good, Kevin, very good, Kevin. We are talking about the medical management which is methotrexate injection. Okay, injection methotrexate intramuscular. Okay, so methotrexate injection intramuscular is the treatment of choice wherever possible. Now when I want to go for medical management, there are 4 main conditions which has to be satisfied. Okay, obviously I cannot give the medical management if the patient is in shock. Okay, so if it is a ruptured ectopic pregnancy or the patient is in shock, then what will I go for? Then I will go for immediate surgical management. Yes or no? Of course, the initial stabilization of the patient is understood. You will give 2 wide bore IV line, IV fluids, cross match, all that is understood. So initial resuscitation followed by surgical management. Is this understood to all of you? So here I should have a hemodynamic stable patient, or basically a unruptured ectopic. Second, when we are doing the medical management, please understand this, that what is the criteria? Yes, the gestational sac should be less than 4 centimeter. Okay, because the gestational sac is more, the methotrexate failure rate is on the higher side, methotrexate will not work. So if obviously my gestational sac is anything more than 4 centimeter, example in the question paper 5 centimeter, 6 centimeter, 7 centimeter, then obviously I have to go and do a surgical management. Is this understood to all of you? And third important point is that the beta HCG, can anybody tell me beta HCG criteria? HCG should be how much for my medical management? What should be the criteria for beta HCG? Yes, beta HCG कितना होना चाहिए? Uh, 4,000. Okay, Kevin. No, please understand, Kevin. Beta HCG, almost beta HCG should be less than 5,000. Less than 5,000 micro international units per ml, also please keep in mind. Okay, and the last thing is that the fetal cardiac activity preferably should be absent. The reason being that if the fetal cardiac activity is present, then again the methotrexate success is much lesser. Is this understood? Okay, so keep this in mind that the beta HCG criteria should be less than 5,000. Okay, obviously if the levels are more than 5,000, then it is better to do a surgery. Similarly, the cardiac activity is present, it is better to do for surgical management. So now all of you know that when I look at this beta HCG less than 1,000, what will I go for? I will go for medical management, methotrexate. Absence of cardiac activity, also very good medical management. Hemodynamic is stable patient, of course medical management. By all this medical, I mean methotrexate. Is this understood? Perfectly correct, many of you. Size more than 4 centimeter is an indication for going ahead with a surgical management. Is this understood to all of you? So when the size is more than 4 centimeter, better to do a surgical management. Okay, is it clear to all of you? Yes. Any confusion, any doubts? Yes. Moving on. Yes. Now this is again very important. A patient has come to you with 45 days of amenorrhea and wants MTP. Which of the following do you think is the best option or the most suitable option or the best option for the patient? Anybody? Yes. Think. Okay. Options have been modified compared to the previous question which was there. And all of you should read the question correctly and then answer it. A, B, C, D. Right, wrong does not matter. Tell me the answer. Yes, anybody? So all of you know. Okay, nobody? Yes. So what are the drugs which we are using for medical for MTP? Okay. So first of all, the medical abortion, the MTP, medical term pregnancy, with the drugs. Okay, up to 9 weeks. Okay, 7 weeks is the best, but then up to 9 weeks of gestation. So 7 weeks, yes, but even now till 9 weeks of gestation, 9, 7, 60 days. Till this time, we can go ahead with the medical abortion. Okay, I'm getting answer as A. I'm getting answer as C. Okay. Dr. Dipantana Biswas, beta, you are confusing. That's your marked A. William Stephen C. Good. Okay. So now please pay attention. The drugs which are there are, what are the 2 drugs available for all of you, or what are the 2 drugs what we go for? Okay, yes. So anybody, mifepristone is my drug. Mifepristone is what kind of mifepristone? Of course, you call it RU486. All of you know that it is a anti-progestogen. It is a anti-progestogen. So it will block the progesterone. It is a single tablet of 200 milligram. Is this understood to all of you? Mifepristone is 200 milligram. Look at our option. This is mifepristone 200 mcg. This is microgram, and therefore option number A is not the answer. And misoprostol, the drug is correct, but the misoprostol is not 800 milligram. Anybody? Each tablet of meso is how much? Remember this picture, you should be perfectly by heart. This is how the tablet looks like, or the packet. Okay, combi kit, it comes as a combi kit. Okay, combi kit means combination. So this is 1 tablet, and then there are remaining 4 tablets. This 1 tablet is your mifepristone. Is this understood to all of you? Yes, yes, very good. Okay, yes, and these are the 4 tablets of misoprostol. Each is 200 microgram. 200 microgram, and there are 4 tablets, so 800. Okay, and on day one mifepristone is given. Anybody? What is one very important point which we should make sure before I give medical abortion? One very important point before I give medical abortion. Okay, and after 48 hours on day 3 is I give misoprostol. Okay, yes, anybody? Yes, very good, Kevin Jain. Ectopic pregnancy definitely has to be ruled out because this option or this method works only for intrauterine pregnancy. So ectopic pregnancy should be ruled out. Okay, so ideally scan should be done. Scan is not recommended 100%, but ideally scan should be done to make sure it is less than 9 weeks and ectopic pregnancy has to be ruled out. Misoprostol, you have to take 4 tablets. Okay, now all the 4 tablets can, that means 800 microgram ho jayega, mcg microgram, or this symbol will be per vaginal route. Okay, per vaginal 800 microgram can be given, और if per vaginal नहीं है तो हम oral और sublingual भी दे सकते हैं. Oral and sublingual we can go 400 because 800 also many people give directly at one shot, but then there's a lot of nausea and vomiting, so 400 can be given sublingual or orally, and again after some time, after another 12 hours, another 400 can be repeated. So basically it is going to be 800. Okay, so this is total 800. Okay, 800 microgram because each tablet is 200 microgram. Is this understood to all of you? So I hope this is absolutely crystal clear. And therefore misoprostol is not 200 microgram, and then mifepristone you don't give ulta. Okay, this is again not that. Then please see, mifi is day 1 and then meso. Similarly mifepristone 200 milligram, yes, 200 milligram, and misoprostol 800 microgram after 48 hours. This option number C is the answer. Is this understood to all of you? And then you don't give meso first and then mifi you don't give, this is again ulta. Okay, so option A, C and D are wrong, and therefore option number C is the answer and is the most suitable thing. Okay, is this understood to all of you? 800 nahi hai and suppose 400 bhi diya hai, that option also you can choose depending on the routes are not given. But just by the way, remember mifepristone is orally. Okay, mifepristone is oral. That they can further confuse you. Okay, so the very popular topics for mifepristone will be oral tablet. Misoprostol can be taken either per vaginal route or even sublingual or oral route. Okay, so moving ahead, yes, now anybody, this is again a very important MCQ, clinical case based MCQ for the upcoming NEET PG examination. Okay, 32 weeks pregnant lady, okay, 32 weeks pregnant lady comes to us with BP of 180, 120, urine albumin +2, she complains of headache, blurring of vision. Okay, no convulsions are present at present. Okay, no convulsions at present, and the best management for this patient is 1, 2, 3, 4. Very important MCQ are definitely coming in this exam. Yes, anybody? Okay, William Stephen is saying 2, option number 2. Kevin Jane, options. Come on, all of you participate. Right, wrong does not matter. Okay, right, wrong does not matter. I want more participation. Yes. So now anybody, what is your diagnosis first? Can anybody tell me the diagnosis of this patient? What is the diagnosis of this patient? Yes, anybody? Kashmira Bose, option 3, okay. Purva Shahane, option 3, very good. Okay, so yes, so anybody, what is the diagnosis? So diagnosis is not only BP of, okay, BP of 180, 120 and you have a +2, so it is not only severe preeclampsia, but yes, very good. No, Kevin, it is not eclampsia. Okay, Kevin, please pay attention. This is the mistake. This is clearly mentioned no convulsions present. So your diagnosis is not eclampsia, but the management becomes very similar to eclampsia. Why? Because it is impending eclampsia. Okay, can anybody tell me what in the question paper tells you it is impending eclampsia? Yes, why is it? What is the meaning of impending eclampsia? Yes, what is impending eclampsia? Very good, Kashmira Bose, impending eclampsia. Purva Sahane, impending eclampsia, very good. Yes, so why do we call it as impending eclampsia? Because what is given in the question paper? Headache and blurring of vision. So there are the 5. These 5 are the dangerous, okay, dangerous symptoms, also called as premonitory symptom. Okay, PMS is premonitory symptom in this case. Okay, so those are your headache. Anybody, what else? Headache, oliguria, okay, epigastric pain, very good, yes, blurring of, okay, nausea, vomiting, and blurring of vision. Okay, these 5 all of you should know by heart: headache, oliguria, epigastric pain, nausea, vomiting, blurring of vision. If these are present, they generally come as a cluster, so 2 or 3. In our patient, they have given you headache is also given to you, blurring of vision is also given to you. Okay, so patient is a patient of impending eclampsia, and when impending eclampsia is there, I still have to go and give magnesium sulfate. Is this understood to all of you? Because magnesium sulfate is not only the drug of choice for eclampsia. Please understand this. Magnesium sulfate is the drug of choice for which condition? Sir, of course for eclampsia I give it, but also please make a note, for this impending eclampsia also we are supposed to give magnesium sulfate. Is this understood to all of you? And therefore I will give magnesium sulfate prophylactically to prevent the convulsions, because it has been proven beyond doubt that when the mother is having this impending eclampsia, when I give magnesium sulfate, it will prevent convulsions, prevent mortality, and prevent complications. So I do not have phenytoin, of course, has got no role. Phenytoin is for, we do not give it, and I do not immediately proceed for LSCS. Sorry, labetalol yes, but only giving labetalol, that's an incomplete option. Only labetalol will not work, and better over here it is 180, 120. So I will require IV labetalol, but it is still an incomplete answer. The best management for the patient. And remember one thing, students, all of you, when you give magnesium sulfate, you should not wait and watch. Magnesium sulfate deke I cannot wait. You cannot say she is only 32 weeks. What will happen if I wait till 37 weeks? No. Why is option number 2 wrong? Option number 2 is completely wrong, because we are giving magnesium sulfate and waiting for 5 weeks. Never. Why should we not do this? Never. Because in that 5 weeks the mother will get convulsion, mother will die. Baby can also die, because delivery, anybody, the definitive treatment is what? The definitive treatment for this condition? Sir, delivery is the definitive treatment. Is this understood to all of you? So in both these cases, once you have got given magnesium sulfate, you should immediately plan the delivery of the patient. Yes, termination of pregnancy or delivery. In this also we first induce the labor first, and if not, C-section. So option number 3 becomes the answer, where I will give magnesium sulfate followed by immediately induction of labor. Is this understood why option number 2 is not the answer? I cannot keep on giving Maxel. Okay, is it clear to all of you? So Maxel, I cannot keep on giving it to the patient. Okay, and I will quickly get chance for one more MCQ. So important topics I've taken of your eclampsia, pre-eclampsia, ectopic, and this. Yes, anybody, absolute contraindication for IUCD is which of the following? Out of the following, which is the absolute contraindication for IUCD? Which conditions I will not use IUCD? Yes, so please understand this, that first of all, yes, okay, past history of PID is not important. Past history of PID you may want to know, it is acute PID. Okay, please understand this, acute pelvic inflammatory disease or your puerperal sepsis. If this is the situation, acute PID or puerperal sepsis, that is the absolute contraindication. That means current. Okay, current episode of PID. Similarly, nothing, past history of ectopic, no problem, you can go ahead and put it. Ectopic, don't blame it on IUCD. So there's an ectopic in the past, this patient can still use this. And yes, menorrhagia, remember, is a relative contraindication. Okay, relative contraindication. Menorrhagia as well as dysmenorrhea, both are relative contraindications for the use of IUCD. You definitely avoid, but can be given. Undiagnosed vaginal bleeding or your suspected pregnancy is the absolute contraindication. So can anybody name me 3-4 absolute contraindications? Can you name me 3-4 absolute? One we already told you. Okay, so undiagnosed, okay, undiagnosed bleeding, okay, or your pregnancy. Okay, pregnancy. Then what else? Okay, undiagnosed pregnancy, acute PID. Okay, so these are my absolute contraindication. Puerperal sepsis. Okay, all these are my absolute. Then yes, cervical cancer, CA, endometrium also becomes your absolute contraindication. And lastly, very important, yes, okay, your uterine anomalies. All of you look over here. Suppose I have got a bicornuate uterus or a didelphys uterus. How will I put IUCD? I will put IUCD only in one side. Other side still pregnancy can happen. Yes or no? So uterine anomalies like a bicornuate uterus or a didelphys uterus, or if the cavity is distorted with multiple fibroids again, then the copper T does not fit properly. Okay, so that again causes. So all these becomes 5-6 become the absolute contraindication. Usme apna option number C is the answer. Is this understood to all of you? Okay, so now in the remaining part of the class, what we are going to do is what all of you been waiting for, the list of important topics. Okay, so all of you please make a note of this. This is extremely important. These are the must know topics. What I'm going to give you now, every year your paper is incomplete without these topics. Okay, 25 MCQs will be coming. Okay, OBGY is a major subject, 25 minimum. If you are lucky, 30 MCQs from OBGY you can expect for sure in the NEET PG. Any extra to more weightage, almost more than 100 plus MCQs are going to come. They've already declared. Okay, so when you look at the gynecology, the first, it's exactly how I teach in my classes for years, how I have been teaching it. That is it. Okay, so infertility becomes a major chunk. In this infertility study, everything by infertility I mean tubal factor, male factor, PCOS, endometriosis. Okay, so PCOS, all male factor, male infertility, female infertility management. Also questions OHSS has started coming, and your IVF, Iucd also what we teach in the classroom. The difficult everything, IUI, IVF, all this infertility is a major chunk. You can spend complete one whole day or at least half a day in this preparation. Then is the major chunk is contraception, extremely important. One MCQ comes, either IUCD, okay, OCPILS, all these are important topics for entrance paper. And then is the topic of primary amenorrhea. Trust me student, if these three topics are perfect for you, infertility, contraception, primary amenorrhea, minimum 4 to 5 MCQs are in your pocket in Gynac is my guarantee, because Gynac out of this 25 questions, almost 10 to 11 questions would be gynecology, and remaining 14 to 15 will be from obstetrics. Obstetrics slightly more important, or they might even give equal absolute. Okay, so primary amenorrhea is very important. Yes, and then you have topics of fibroids. Fibroids must know topics. Okay, prolapse may or may not come, menorrhagia and your dysfunctional uterine bleeding or abnormal uterine bleeding, again a very popular topic. So ये 5-6 topics आप अच्छे से कर लो and you are definitely sorted. And of course last is the oncology. In this the mainly CA, cervix, and yes, questions on ovarian tumors and endometrial cancers are also coming or may come. So these are the must know. And do not forget, at number 7 is our infection, the simplest topic, easiest topic. Infections का मतलब है your bacterial vaginosis, Gardnerella infection, that very simple clue cells, all that popular MCQ, sometimes genital TB. So these 7 topics में से आपको definitely 11 to 12 questions would be coming. Infertility, contraception, primary amenorrhea, fibroids, menorrhagia, oncology, infections, and in the last part if you want to write your urogynecology also. So please buy this urogynecology. So this is how your paper for gynecology is going to look like, is my guarantee. This has been the rule and this will be the rule for all the upcoming exams, is my guarantee. So just if you do on this, your 10 to 12 marks are sorted for gynac. Okay, so this is important topics in gynecology. Okay, is it clear to all of you? Now moving on to the list of important topic for obstetrics. The most important you need to know is your trisomy 21 antenatal detection. By this I mean everything: dual marker, triple marker, quadruple marker test. Okay, so I'm just writing dual marker test, quadruple marker test, triple marker test, and your confirmatory amnio CVS, all this based on which 1 to 2 question comes for sure. Is this understood to all of you? Very important chunk is malpresentations. By malpresentations I mean breech, brow, transverse. Mainly popular is breech and transverse lag, based on which question comes for sure. Okay, postpartum hemorrhage, extremely important topic. VBAC trial of scar, again very important. Okay, forceps and vacuum. Okay, that is your instrumental delivery. Okay, इसके अलावा छोटा मोटा something to do with the placenta, yes, management of normal labor and active management, third stage labor, something to do with labor and mainly abnormal labor may come to all of you. Okay, so these are the important topics initial part के लिए. Then as you proceed further, very important topic of preeclampsia, eclampsia, what MCQ we discussed today. Okay, then you have the most important medical disorders in pregnancy. Medical disorders may mainly anemia in pregnancy, diabetes in pregnancy, and heart disease in pregnancy. So these are the extremely important topics. And then you have antepartum hemorrhage, which is your abruption and placenta previa and ectopic. Trust me. So this 10 also gives you 8-9 MCQs and majority, but still couple of more are important, which is your twin pregnancy, multiple gestation, and lastly is your very rarely sometimes preterm postdatism. Okay, preterm postdatism can also come. And of course, yes, one more very important is miscarriage. By miscarriage I mean all the types, what is threatened abortion, incomplete abortion, first trimester abortion, second trimester abortion, all that is very important. Okay, and yes, so based on which definitely the questions come to you. And liker disorders, which is oligohydroamnios, polyhydroamnios, all these are extremely important topics. Okay, so this is, if you know, yes. And the last part is the test for fetal well-being, that is your NST, BPP, AFI, the test for fetal well-being. Okay, so trust me students, this has been based on my years of experience. Every year we predict and every year we are correct. Those who have given the recent NEET PG also know that all 25 questions were from my lectures. All of you know that. So these are the must know topics which are there. नो बेटा श्रीधर, ये सब सारा सिलेबस नहीं है बेटा. शाहिदुर रहमान तालुकदार, बहुत सारे टॉपिक्स आर देयर. ओके, प्रोलैप्स इज नॉट देयर. ओके, डिस्मेनोरिया इज नॉट देयर. ओके, सिमिलरली हियर बेटा प्लासेंटा, फिजियोलॉजिकल चेंजेस ड्यूरिंग प्रेगनेंसी, लॉट्स ऑफ टॉपिक्स which are not okay, PROM. So these are the major chunks of topics. Okay, so these are the must know topics. It's not the complete syllabus, these are the in short what you know. Okay, so these are this, and that's why beta only in 3 to 4 days time, the golden rule. Okay Shahadur, how in just a matter of 5 days, okay, 100% my guarantee, जो my 32 to 36 to roughly 40 hours lectures are there. Okay, 40 hours easily. 4 hours lecture can you see every day? Yes, go on the Unacademy platform, use the mentor code Shahidur today only, and you will remember me and thank me on the day of the exam, is my guarantee. 40 hours lecture, just see my videos, 4 hours every day, and the next 10 days you will be prepared like never before, is my guarantee. You will wish that you should have subscribed much long ago. So just in the next 10 days time, complete preparation is possible with my comprehensive course of 40 hours, which will cover everything, and the month of February itself, and we will teach you in such a way that long term you will remember. February you finish off, you will not have to remember it. You will not even have to revise it in the month of March and April, is my guarantee. Okay, just 4 hours every day videos you see, followed by, because in this I'll be discussing MCQs also, and there's a 40 to 50 hour session, and the next 10 to 12 days time your entire preparation would be done. Yes, yes, Chavez Maro also, you can go and do it yesterday. Okay, yes. So Yes, okay, so this is our time, and that is this, and I'll be seeing you again and again. Also, there are upcoming sessions. Okay, we are going to have the special classes on the Unacademy from today also at 8 p.m. and tomorrow also we have got a free class for all of you at 3:30 in 3 o'clock in the afternoon. Okay, so 3 p.m. tomorrow and 8 p.m. today evening on the Unacademy platform. There are special classes. All of you can come and see those lectures also. So just follow me, so that whenever you got the upcoming classes, you'll get the notification. This is what I have done, at the most frequently asked questions, the list of important topics we have discussed for all of you, and I hope this is very, very important. The strategy is that all of you can quickly enroll and just 4 hours study, 4 hours of videos. Okay, 4 hours of videos. Okay, and with this 40 hours of videos, it is 100% more than enough to crack any of the NEET PG examination. Okay, bye bye, best of luck, thank you very much for coming in today, and see you soon. Okay, see you soon, best of luck, and all the best for the upcoming examinations.